All right, it is Thursday of week 2 of the Zoom review. Zoom review for the introduction to PTA class. We're going over bones and muscles, and today we're going over muscles. All right, so let's start where we left off yesterday. This will be, by the way, the 7th meeting, 3 last week and 4 this week. So let me go to the screen, pull up the lecture that we left off at yesterday. Let me pull it up to the larger screen. Give me 1 sec. All right, so yesterday we left off at the biceps brachii. This is a muscle we speak about an awful lot. It is quite superficial, so it's one that we work with a lot. You have to know both origins of this muscle. The long head is at the supraglenoid tubercle of the scapula, while the short head is at the coracoid process. The long head goes through the bicipital or intertubercular groove on the humerus, and both the long and short head meet up at around the midshaft of the humerus. The biceps crosses the elbow joint and inserts onto the radial tuberosity. The innervation of this nerve is the musculocutaneous nerve. And there are 3 main actions that the biceps brachii performs. It performs shoulder flexion, elbow flexion, and it supinates the forearm. Please understand that when I say supinates the forearm, it is this part of the arm that it supinates. It does not supinate the wrist. The wrist only goes for the ride in the movement of supination and pronation. Okay? It's the forearm where this movement is occurring. Remember, I said the radius, when you are in the supinated position, the radius and the ulna are parallel. When we pronate, the radius is the only bone that moves, and it crosses over the ulna, creating an X shape. When it returns to supination, it returns to the parallel position. So you need to know everything about the biceps brachii. The next muscle is the brachialis. As you can see from the picture, this muscle has nothing to do with shoulder. It does not cross the shoulder joint. The only action is at the elbow. The only action that the brachialis performs is at the elbow. The origin of this muscle is the distal half of the humerus on the anterior side. So this muscle is basically underneath the biceps. Brachialis inserts into the ulna bone, onto the coronoid process of the ulna. And so that sharp pointed area on the just above the notch of the ulna is the coronoid process. The brachialis is innervated just like the biceps by the musculocutaneous nerve. And the only job that brachialis does is that it flexes the elbow. Now, when we get into kinesiology, you'll find out that the brachialis muscle itself is basically the workhorse of all 3 of the elbow flexors. When the nervous system decides on which of the elbow flexors to use. The brachialis is the choice usually, unless there are other movements to take into account. Like if you were going to put a screw into the wall, well, that's going to require supination and elbow flexion. That sounds like something the job of biceps brachii would do. And the nervous system makes those decisions because the nervous system wants to use muscles that are going to be independent and to provide as little fatigue to the patient as possible. So again, brachialis is the workhorse of the elbow flexors. When we're talking about the elbow flexors, remember there are three main elbow flexors. We have the biceps brachii, the brachialis, and brachioradialis, which we will talk about in a few minutes. Another thing about these elbow flexors is that we can separate the movement just by changing the position of our hand. For instance, if I put my palm out in front like this with my palms up and elbow flex, it is the biceps that performs this motion with palm upwards. If you were to palpate and feel the biceps area, when you did that, you would feel the muscle contract and extend, contract and extend. If you go into the neutral position, I call it a handshake position, and do elbow flexion, it is the brachioradialis that performs that action. And if you have your palms down in the pronated position and perform elbow flexion, it's the brachialis that performs that motion. So again, palms up, elbow flexion is the biceps brachii. The hand in the neutral position, like you're shaking hands, is the brachioradialis. And the palms down, or the hand in the pronated position, is the brachialis muscle. Speaking of the brachioradialis, here is the third of the major elbow flexors. If you take a look at the picture here on the right, you'll see it starts up here on the humerus. It crosses over the elbow and then becomes a long tendon that actually attaches to the styloid process of the radius. This muscle has nothing to do with the wrist. The styloid process of the radius is on the radius. It's not on a carpal bone. So remember that brachioradialis has nothing to do with the wrist. It only does elbow flexion. And you're going to see on some cards that it does some pronation and supination because it's on the radius, but it is not a main mover of that movement. What I want you to know is that brachioradialis is a major elbow flexor. So brachioradialis comes from, again, on the distal end of the humerus, right here. That area there is known as the lateral supracondylar ridge. So right above the lateral epicondyle, there is a roughened ridge area, and that roughened ridge area is where the brachioradialis sits. So the lateral supracondylar ridge for the origin of brachioradialis, and its insertion, again, is into the styloid process of the radius bone. Again, this muscle has no actions at the wrist. because it does not cross the wrist joint. The innervation of brachioradialis is the radial nerve, and its main action is to flex the elbow. As I said here on the bottom, a lot of sources will show that it does some forearm pronation and supination, but it's not a main mover. Now, when the big guy or gal upstairs made us, they did a pretty darn good job. So if there are some muscles, let's just say the supinators of the body are not working, and the supinators, you would remember the biceps, but also there is a supinator muscle also. Well, if those muscles are weak, well, brachioradialis has the ability to perform some pronation and supination at the forearm. But again, like I said, it's not a main mover of those motions. So it's not really something that we're going to need you to know. You do need to know that it is a major elbow flexor. The Anconeus is a small muscle. All right, it's a small muscle. What I need you to know about the Anconeus muscle is that it crosses the elbow joint, and it's on the posterior side. And the main job of Anconeus is to extend the elbow. Anconeus does elbow extension. It assists the triceps brachii in the movement of elbow extension. Know that it's on the humerus, and know it's on the olecranon process and the ulna. All right. But more importantly, you need to know that Anconeus, a small muscle, it's deep. Okay. And this muscle helps with extending the elbow. Coracobrachialis, this is one of those muscles that its name is going to be telling you where its location is. All right, so coraco is the coracoid process right here. Remember, the Latin term or the medical term for the humerus is the brachii. And that's that area there. So this muscle has its origin on the coracoid process of the scapula, and it inserts onto the midshaft of the humerus. The midshaft of the humerus. This muscle, like the biceps, as you can see here, the biceps actually go from here to here and attach here down to here. So so the biceps is actually very close by. So the biceps brachii and the coracobrachialis both have the same innervation, being the musculocutaneous nerve. Because this muscle only crosses the joint, it only has movement at the shoulder. Coracobrachialis does no motions at the elbow. It can't, because it doesn't cross the elbow. Remember, these muscles, in order to perform an action at joints, they have to cross joints in order to do it. Well, coracobrachialis will only do shoulder motions. The main movement of coracobrachialis is shoulder flexion. Now remember, I gave you an acronym for shoulder flexion as A, B, C plus pec major. we've now gone over the four muscles, the four major muscles that perform shoulder flexion. The anterior delt is the A, the biceps brachii, the B, the Coracobrachialis is the C, and the pec major. Those four muscles perform shoulder flexion. Very important movement that we perform on an everyday basis. And these are muscles that you should be able to tell me without any problem in week 2. Now, as you can see, well, I hope you can see it. Remember, I spoke about thinking in a 3-dimensional movement. So remember, here is the origin up here, and here's the insertion up here. Okay, so in order to flex, the insertion moves closer to the origin, and that moves the humerus upwards. But when the humerus abducts and goes out to the side, this muscle stretches, it becomes lengthened. All right, it's not contracting and coming shorter, it's becoming lengthened. So this muscle is considered a weak shoulder adductor. All right, it is not a main movement of the coracobrachialis, but because it's stretched out, when somebody adducts their shoulder and brings it back down towards the body, the coracobrachialis is coming together. It is contracting a little bit. The coracobrachialis does have a little shoulder adduction, but it's not a main mover in adduction. It is a main mover in shoulder flexion. So again, the name, in this case, the name of the muscle is going to give you a really good idea of where this muscle is located. Coracobrachialis, its origin is on the coracoid process. It inserts onto the medial shaft of the humerus. It's innervated by the musculocutaneous nerve, and its main function is to perform shoulder flexion. And it performs shoulder flexion with 3 other muscles: anterior delt, biceps brachii, and the pec major. So those were all the muscles basically on the shoulder and on the humerus. Now we're going to move down from the shoulder. We're going to move down to the forearm. All right, there's a lot of muscles here. And like I said earlier, the name of the muscles are going to tell you certain things. So when I speak about it, really get an understanding of what the names mean. Because here's the thing, there are a lot of elbow wrist and forearm extensors, and there are a lot of flexors. Sometimes you can't remember them all. So understanding the name will give you what the muscle does, where it inserts into, and let me just think of something. And the side that the muscle will be on. And that's important because when you know the side, you're going to know other actions that are important to it. So the elbow, the forearm are capable of flexion, extension, and the forearm is capable of pronation and supination. The principal elbow flexors I've spoken about: brachialis, brachioradialis, and biceps brachii. And like I said, brachialis is the workhorse between those 3 muscles. In that, brachialis produces about 50% more power than even the biceps brachii. And the biceps brachii is a stronger muscle. But when it does elbow flexion, because brachialis only crosses one joint, it actually does a stronger elbow flexion than the biceps. Remember when we talked about elbow extension, we talked about the triceps brachii and that small muscle on the posterior side known, wow, brain freeze there. Give me 1 second. Wow, I just had a little bit of a brain freeze. Geez Louise. Known as the Anconeus muscle. My apologies. So when we're looking at elbow extension, it is the triceps brachii and the Anconeus that perform that movement. We've gone over some of the muscles that actually already act on the forearm. If we look at letter A, which is that middle picture there, the deltoid comes from multiple areas and it inserts onto the deltoid tuberosity. Remember the triceps, the long head is on the infraglenoid tubercle, and the other two heads are on the humerus. The brachialis and the brachioradialis are elbow flexors. Pec major is a major shoulder mover. All right, has nothing to do with the elbow really, but it is on that forearm area. If we look at the picture on the bottom, we're seeing a posterior view of the muscles. All right, so remember it's a posterior view because of that spine of the scapula. And from the muscles, you can also tell it's the back because the latissimus dorsi is there. So starting from the top, we have the supraspinatus, which is the S of the sits muscle. The infraspinatus, which is right underneath the spine of the scapula. We have teres minor, which is the third rotator cuff muscle. Remember, the teres minor and the teres major both have origins on the lateral border of the scapula. Teres minor is above the major, but remember the difference. Teres minor inserts into the greater tubercle. Teres major inserts into the lesser tubercle. The triceps are shown here, as is the latissimus dorsi. Again, remember with the latissimus dorsi, very expansive muscle, very large. This muscle has multiple origins, including the iliac crest, the vertebra, right, the lower thoracic and lumbar vertebra. It has an origin on the lower four ribs, and it has that one tricky origin at the inferior angle of the scapula. And remember, latissimus starts on the back, but it inserts onto the anterior side of the body in the bicipital groove. So it does a shoulder rotation. It does a medial rotation. Okay? It does a medial rotation. Again, we've gone through some of these muscles. Some of the forearm muscles act on the hand and the wrist. Brachioradialis, remember, is not one of them. Brachioradialis only flexes the elbow. Anconeus only extends the elbow. Pronator Quadratus, we'll talk about that muscle in a second. Pronator is telling you the motion that this muscle does. Quadratus is telling you the shape of the muscle. All right, so Pronator Quadratus only does pronation. Pronator Teres assists Quadratus in pronation. This muscle crosses the elbow a little bit and lands on the radius, which we'll talk about in a few minutes. So this muscle has a minor movement in elbow flexion. But those two pronator muscles are the major pronators of the forearm. We have the supinator muscle. Here's a muscle that its name is telling you its action. The supinator supinates the forearm. Remember, the biceps brachii is a major supinator of the forearm. So those two muscles work together to perform supination of the forearm. So let's talk about that movement of supination and pronation. As I have spoken about, whenever the forearm and the hand is palms up, you will notice that the two bones here, here's the radius and here's the ulna, and I can tell it by the shape. The head of the radius is here, but I can also tell it by the thumb and the pinky. The radius is on the thumb side and the ulna is on the pinky side. So just by looking at certain landmarks, and I can tell where bones are, which bones are. So when the forearm is supinated or facing anterior or superior, the radius and the ulna are parallel to each other. They look like train tracks, as you can see here, as I put the line through each of those bones. They're parallel. The main muscle that performs supination is the supinator muscle. The supinator muscle is right here. We'll talk about that separately in a few minutes. You'll notice the Pronator Quadratus is on the other side right there. I'm sorry, Pronator Teres is this muscle here. And the Pronator Quadratus is down near the wrist area. Does not cross the wrist. And again, quadratus means four sides. This is a four-sided muscle. So again, supination is where the palm faces upwards. In the anatomic position, the palms are facing forward or anteriorly. In that case, the radius and the ulna are parallel to each other. When we perform pronation, pronation is when the palm faces downwards. Here's the palm. It's facing downwards. When that happens, the radius bone right here crosses the ulna bone, creating this X shape. And again, it is only the radius bone that moves. It is only the radius bone that moves. For pronation, it's these two muscles that perform it, Pronator Quadratus and the Pronator Teres up here. Those are the major pronate muscles in the forearm. So again, remember, the radius during pronation is the only bone that moves. The ulna does not. The supination muscles are the supinator muscle and the biceps brachii. The pronation muscles are the Pronator Quadratus and the Pronator Teres. So let's look at these muscles specifically. First is the supinator muscle. Again, it's telling you what it does. This muscle supinates the forearm. Supinates the forearm. This muscle comes from the lateral epicondyle of the humerus, and it attaches to the proximal radius. Remember, proximal and distal. In this case, here's the radius bone right here. Oops, let me move back, sorry. Pull my pencil out. So here's the radius bone right there. That's the radius. So this is the proximal end right here. And as we go down, we go more distally. So the origin is the lateral epicondyle of the humerus, and supinator sits and inserts on the radius bone. It sits on the radius bone as its insertion. Remember, it's the radius bone that moves. So if you're pronated like this, in order to supinate, we've got to go palms up. And remember, it's only the radius that moves. The innervation for the supinator muscle is the radial nerve. Again, the main function of the supinator is its name. It performs supination of the forearm. It rotates the radius. Now, we spoke about with the elbow flexors that brachialis is the workhorse of the elbow flexors. Even though biceps is a bigger muscle, the nervous system wants to use brachialis more because it's more functional, much more functional use of the muscle. Understand this, and we'll talk about it in kinesiology. The biceps brachii is a two-joint muscle. It has to spread its action across two joints. Remember, it does flexion at the shoulder, which is one joint, and it does flexion at the elbow, which is another joint. It also does that supination too, because it inserts onto the radial tuberosity on the proximal radius bone. When we're talking about the supinator muscles, again, biceps brachii is part of the discussion. When we supinate the forearm, it's either the biceps brachii or the supinator. What the nervous system does is, if we can just use the supinator to do the movement of supination, that is the muscle that the nervous system will choose. The supinator is the first muscle to respond to a task that doesn't require a lot of energy. I mean, why use a big muscle that's going to use energy up when you can use a smaller muscle to do the job? The biceps are used to supinate when greater force is used. For example, if I just have my palm down in the pronated position and all I want to do is move it like this, so palm up, that's the supinator muscle doing the job. Not a lot of power, not a lot of energy is required. So we can use the smaller supinator muscle. When we require more energy, when we require more force, then the nervous system is going to pick a muscle that's going to benefit the body. Well, a motion that you would do, again, is taking a screw and screwing it into the wall. That takes quite an amount of energy. All right, your elbow is flexed and you're performing supination in order to get the screw into the wall. So the biceps muscles are used when greater force of supination is required. And these are important aspects when we get to kinesiology. There are certain concepts known as active and passive insufficiency. I have no intentions of haunting you with that now, but I want you to hear the words. All right. And these concepts have everything to do with a muscle's ability to work at two joints. So we're looking at two joint muscles with those two concepts. For instance, like the biceps brachii, the triceps brachii is at the shoulder and is at the elbow. you're going to see in the forearm, there are a bunch of muscles that are two joint muscles where they cross the wrist and they work on the fingers. So it's very important to understand where these muscles are at, because some of them have multiple movements. We already saw that the biceps brachii has 3: elbow, shoulder flexion, and supination. So this is the supinator muscle. It's located on the proximal, just underneath the elbow. All right, as you can see right up here. All right, it's located right up there. All right, here's the distal end down here. This is the distal end. And up here is the proximal end. Again, remember those directional terms. You're going to hear them all the time. All right, those directional terms we went over last Wednesday in the Zoom video, in the 3rd video. So the supinator muscle. The next muscle is the Pronator Teres. Again, this muscle is telling you what it does. It is a pronator of the forearm. This muscle, too, is on the proximal side. It actually has an origin at the medial epicondyle right here. That's the medial epicondyle. And it has an excursion onto the radius, again, to the proximal radius. Again, only the radius moves. Okay? So when we do pronation, the radius moves and does the X shape. When we go back to supination, the radius moves back into place where it's parallel with the ulna. So Pronator Teres starts at the medial epicondyle. It inserts onto the proximal third of the radius. This muscle is innervated by the median nerve. The median nerve. So that's the first time we've heard that. We're going to hear that a few more times, trust me. The main action of the Pronator Teres is pronation of the forearm. Remember, I said that it also crosses the elbow joint. Because it crosses the elbow joint, here's the origin, and here's the insertion. When this muscle contracts, when the insertion comes closer to the origin, it's going to produce a weak elbow flexion movement. Okay? Just because of its location and how it crosses the elbow joint. But it is not a main mover. Pronator Teres is not a main mover of elbow flexion. Remember, the main movers of elbow flexion: biceps brachii, Brachioradialis, and Brachialis. So the Pronator Teres, it is a pronator of the forearm. The Pronator Quadratus. The Pronator Teres works in the proximal section of the arm up here, and the Pronator Quadratus works on the distal end of the forearm. As you can see here, Pronator Quadratus has nothing to do with the carpals or the hand. Pronator Quadratus only performs pronation. That's all it does. It is a forearm pronator. Remember, Pronator Quadratus is distal. Pronator Teres is proximal. Real easy origin and insertion. The origin is on the distal ulna. The insertion is on the distal radius. Boom, done. Remember, the insertion moves closer to the origin. That's why, again, the radius bone is the bone that moves in pronation and supination. Pronator Quadratus is a median nerve muscle, just like Pronator Teres. And again, its only job, its only function is to perform forearm pronation. Pronator Quadratus. It's telling you what it does, and it's telling you what it looks like. What you need to know is that Pronator Quadratus is on the distal forearm, Pronator Teres is on the proximal forearm, Quadratus origin is on the ulna, and its insertion is on the radius. Now we're going to get into the forearm muscles. All right, the forearm muscles. So a couple of things that you need to know right away. Okay, specifically, muscles that are flexors, flexors of the forearm, flexors of the wrist, and flexors of the finger have something known as the common flexor tendon. Right here, the common flexor tendon. And what that means is that the majority of the flexors has its origin at the medial epicondyle of the humerus. The medial epicondyle of the humerus is the common flexor tendon for the flexors of the forearm, the flexors of the wrist, and the flexors of the finger. There is also a common extensor tendon that is located on the lateral epicondyle. So if you ever forget where the origin is, just know that, well, all the flexors of the forearm come from the medial epicondyle, and the majority of the extensors come from the lateral epicondyle. So that's the first thing I need you to know, because that's going to tell you origin. That's going to tell you where it is. So give me 1 second. I'm sorry. Excuse me. A little ginger ale is good for you. Now let's look at the names of these muscles. The flexor carpi radialis. Like I said, most of these muscles are going to tell you what they do, where they insert into, and what side they're on. Remember, I said already that the origin of the flexors is the medial epicondyle. So this muscle, the flexor carpi radialis, flexes. Right now, all you know is that it flexes. Whenever you see the word carpi, what that means is that we're talking about the carpals of the wrist or the base of the metacarpals. These muscles that have carpi in them do nothing at the fingers. They do nothing at the fingers. They only work at the wrist. Remember, let's remember those wrist movements. So we have wrist flexion. We have wrist extension. I don't have a lot of that. We have, here's my thumb. We have radial deviation to the thumb side and we have ulnar deviation. So whenever you see the word carpi, the muscle only has actions at the wrist. It does nothing at the fingers. So now we know that this is a flexor of the wrist. All right. Radialis. Radialis is telling you what side this muscle is on. Remember I said the radius bone is on the thumb side. The ulna bone is on the pinky side. So what this is telling me is that this muscle is somewhere in this area. It's somewhere in this area here. I know its origin is the medial epicondyle. I know it's a flexor of the wrist, and I know it is on the thumb side. Just by the name. Just by the name. That's a lot of information. Okay, now let's look at the exact information. The origin is the medial epicondyle of the humerus. Flexor carpi radialis inserts into the base of the second metacarpal. It inserts into the base of the second metacarpal. That's the metacarpal, is that long finger. This area right here. As you can see, the muscle, here it is right here. And it's ending up right there. So it's at the base of the long bone of the hand. That long bone has nothing to do with the fingers in the palm. This too, like the two pronators, are median nerve innervations. Flexor carpi radialis, you will see a lot of times with me, you'll see it as FCR. All right. I like to shorten things a lot. So I won't shorten it on a test, but if I'm giving an assignment, or if I'm giving an example, I'll sometimes break the word down a little bit so I don't have to write so much. The actions of this muscle. Well, one of the actions you already know. It's a flexor of the wrist. It flexes the wrist. But it also does wrist abduction, which is radial deviation. Remember, the muscle is on the radial side. So it's going to perform radial deviation. So its actions is wrist flexion and radial deviation. Wrist flexion and radial deviation. Now, this is just information really for kinesiology. But we're going to go over what the carpal tunnel is probably either a little later today or Monday. But this muscle is not within the carpal tunnel itself. That carpal tunnel is in the wrist. And for you guys that have carpal tunnel syndrome, very, very painful. The pain can radiate into the hands, cause great weakness and atrophy, and it can also radiate into the elbow and shoulder. Right? It really is a nerve injury. It's a nerve injury that actually puts pressure on the median nerve because it's such a small area for a lot of structures to go through. But flexor carpi radialis is not one of the muscles that go through that carpal tunnel. So, flexor carpi radialis is a flexor of the wrist. It inserts onto the carpals, specifically the second metacarpal. It's on the radial side. It's a median nerve muscle. Again, it's a median nerve innervation. And again, its actions is wrist flexion and radial deviation. Please remember this when we're talking about all of these muscles in the forearm. whether they're flexors or extensors, and whether they go to the fingers or don't, they always have an action at the wrist because all of these muscles have to cross the wrist. All right, they're long muscles. They're coming from the medial and lateral epicondyles, and they're going over the wrist joint. So they're going to have an action at the wrist. So flexor carpi radialis. If there's a flexor carpi radialis, there's got to be a flexor carpi ulnaris. All right. Again, taking it the same way that I spoke about the other muscle. It's a flexor, which means its origin is coming from the medial epicondyle, the common flexor tendon. Now, flexor carpi ulnaris has a little part of it on the proximal ulna, but not the major part. Again, it's a carpi, which means I know it has nothing to do with the fingers. And it's an ulnaris, which means it's going to be on the pinky side. So let's see. Carpi, so its insertion should be on the carpals or the metacarpal. Well, flexor carpi ulnaris is at the base of the fifth metacarpal, the base of the fifth long bone. It actually inserts onto the pisiform bone. It actually is on the pisiform bone. All right, remember that pisiform, you know, scaphoid, lunate, triquetrum, and pisiform. That was the proximal row. All right, flexor carpi ulnaris inserts on the pisiform. We'll talk about that in a few seconds. Because it's on the ulnar side, though, its innervation is the ulnar nerve. Right? The innervation of flexor carpi ulnaris is the ulnar nerve. So the actions of this muscle. Okay, like I said, if it crosses the wrist, it's going to do flexion. Well, it does flexion. It does wrist flexion, and it's on the ulnar side, the pinky side, which means it's going to do ulnar deviation, also known as wrist adduction. Remember, in the anatomic position, with your palms facing forward, if you ulnarly deviate, you're bringing your pinky towards your body. If you radially deviate, you're bringing your thumb away from your body. Hence, wrist abduction and wrist adduction. It is something you can hear. It is something the national exam can and will try to trick you on. Okay, wrist does have ab and adduction. It's just the names are a little different. Abduction, going away, is radial deviation. Adduction, adduction, is ulnar deviation. Now, I spoke about with the bones in the first two videos that there is these bones that are actually embedded in muscle or embedded in a tendon. One of the bones that we spoke about that did that was the patella bone. The patella bone is embedded in the quadriceps tendon. When a bone is embedded in the muscle or in the tendon, it is known as a sesamoid bone. A sesamoid bone is a bone embedded in muscle or tendon. The flexor carpi ulnaris attaches to the pisiform, and the pisiform is actually embedded into the muscle itself, into the tendon. And that makes the pisiform your second sesamoid bone. So the patella and the pisiform are sesamoid bones. this. I hope everybody is doing well. I hope I haven't put everybody to sleep yet. So there is a set order of these muscles. So if you were to go from the medial epicondyle and go over towards the lateral epicondyle, you have the flexor carpi ulnaris, you have palmaris longus, you have flexor carpi radialis, and pronator teres, all in an order. All in an order. All right. So again, if you're having trouble with figuring out where these muscles are located, this is the kind of thing that helps you out a bit. Okay. Now we haven't gone over palmaris longus yet. We're going to go over that one most likely next. So, and there is the good old palmaris longus. So we have flexor carpi radialis on the radial side. We have flexor carpi ulnaris on the ulnar side. In between those two muscles is the palmaris longus. Palmaris longus is a flexor. Since it is a flexor, it comes from the medial epicondyle of the humerus. Palmaris longus is a flexor, which means it comes from the medial epicondyle of the humerus. The palmaris longus inserts into the palm. Myself and the national exam is not going to haunt you on the flexor retinaculum and palmar aponeurosis. No, they will not do that to you, and nor will I. All right? Palmaris longus inserts into the palm. It's telling you where it's going. Palmaris longus is a flexor. It's not telling you that. I am. It's a flexor, so it's on the medial epicondyle. Has palm in it, it inserts into the palm. Innervated by the median nerve. And again, the only job of palmaris longus is wrist flexion. The only job. It does no deviation. Flexor carpi radialis did radial deviation. Flexor carpi ulnaris did ulnar deviation. This muscle's right in between. It really can't do any deviation. All it can do is flex the wrist. Again, has nothing to do with the fingers. All right? Palmaris longus. Now, this is a very, very special muscle. A lot of people actually do not have this muscle. All right? About 10% of the population actually does not have it. They might have one on one side and they don't have it on the other. I am one of those guys. So if you can't see it, but I'll show it to you in kinesiology. There's a tendon. When I bring my thumb and my pinky together in opposition and flex a little bit, there is a little tendon that pops out here. Yeah, you can see that now. You can see how this tendon pops out. Well, that's palmaris longus. So I have a palmaris longus on my left hand. If I do the same thing, do opposition and flex on the right hand side, there is no palmaris longus on my right. Try it yourself. Opposition, thumb to pinky, and wrist flexion. You will pop out a tendon, or you might not pop out a tendon. This muscle is actually used for surgeries. This muscle, believe it or not, you really don't need. This is not an important muscle. So if you have one and you were to tear an elbow ligament, there is a good chance that the surgeon is going to use, look how long this tendon is. They're going to use the tendon from that muscle to fix those ligaments. This is one of those muscles that you really don't need, because if you have a working flexor carpi ulnaris and a flexor carpi radialis, you have the main movers of wrist flexion in those two muscles. And if it was really required that you needed surgery, well, this is a tendon that they take from. I know, a lot of cool stuff. So again, about 10% of the population does not have this muscle. Again, you can find it by flexing the wrist and cupping the palm. The tendon will pop right out. The tendon will pop right out. Okay? All right. Since we have flexors, we definitely going to have extensors. Remember, we got to extend the wrist too. Well, the same rules apply here. All right, just a different set of muscles. So this is the extensor carpi ulnaris. This muscle is here on the top of the arm. Flexors are on the bottom of the arm, or the anterior portion in anatomic position. Extensors are on the back side. Whenever I hear extensors of the forearm, I know that the origin is going to be at or near the lateral epicondyle of the humerus. It's because it is the common extensor tendon. Remember, common flexor tendon is the medial epicondyle. The common extensor tendon is the lateral epicondyle. So I know its origin is at the lateral epicondyle. It is an extensor. Okay? I don't know what it's extending yet. Let's go on with the name. Extensor carpi. Carpi tells me that it's either going to insert on the wrist or a metacarpal, that long bone. Okay? This has nothing to do with the fingers. And finally, it's an ulnaris, which means it's going to be on the pinky side. So let's see. The origin, lateral epicondyle. It inserts into the base of the fifth metacarpal, back here. Right, on the dorsal aspect. Remember, ventral, dorsal. On the dorsal aspect, on the base of the fifth metacarpal, it's on the ulnar side. Extensor carpi ulnaris is innervated by the radial nerve. The radial nerve. Again, because it crosses the wrist, it does wrist extension. Wrist extension. And because it's on the ulnar side, it does ulnar deviation, just like flexor carpi ulnaris. So you're noticing that there's a lot of these muscles, but if you pay attention and you stay calm, the names are going to help you. The name will help you. Extensor carpi ulnaris. It's an extensor, which means its origin is going to be on the lateral epicondyle, or very, very close to it. It's a carpi. It means it has nothing to do with the fingers. It's going to be either on the wrist bones or on the metacarpal. And it's an ulnaris, which means it's on the ulnar side. It's either going to be on digits 4 or 5. Well, this one is on the base of the fifth metacarpal. Because it crosses the wrist, it does wrist extension. And because it crosses the wrist and is on the ulnar side, it also does ulnar deviation. Extensor carpi ulnaris. We have an extensor carpi radialis, but we have two of them. We have two of these. We have a longus and we have a brevis. All right, we have a longus and we have a brevis. Let's start with the longus. Extensor carpi radialis longus. Let's just take it by the name. It's an extensor. We don't know what it's extending yet. It's a carpi, okay? It's going to be on the wrist bone or on the metacarpal. No fingers. It's a radialis. It's going to be on the radial side. It's a longus, which means it's going to be long. I know. Who knew muscles were so easy, right? Okay. If it's an extensor, it should be on the lateral epicondyle, which is the common extensor tendon. Longus is not. Longus is above the lateral epicondyle. It's on the lateral supracondylar ridge and a little bit on the lateral epicondyle. But because it's the longest, it's longer. So it inserts onto the supracondylar ridge of the humerus. It inserts onto the base of the second metacarpal. So longus, supracondylar, lateral supracondylar ridge to the second metacarpal. Brevis is a shorter muscle. It comes from the lateral epicondyle and it inserts into the third metacarpal. Okay, so they're both on the radial side. Carpi radialis, longus, and brevis. Okay, they are both innervated by the radial nerve. Their actions, it crosses the wrist, it's wrist extension. It's on the radial side. They both do radial deviation. So extensor carpi radialis longus is a little tricky. So when you're thinking about it, here's your lateral epicondyle right here. Here's the lateral epicondyle. Its extensor carpi radialis longus is longer. So if it's longer, it's going to be just above the lateral epicondyle. Sorry, over here on this side, my apologies. Okay, it's going to be longer. It's going to be above the lateral epicondyle. In order for it to be longer, it's got to start out longer. So it starts up here. It goes over the lateral epicondyle. That's another origin. And then inserts onto the second metacarpal. Extensor carpi radialis brevis, shorter of the two, starts at the lateral epicondyle and goes to the third metacarpal. Okay, second and third metacarpal for the insertions. Radial nerve innervation. Both of the muscles extend the wrist, and both of the muscles radially deviate the wrist. So notice in the picture how close these two muscles are located to each other. They're really close to each other, literally creating a very strong extensor. Right up here is the origin of longus. Right here is the origin of brevis. Remember, longus is a longer muscle. All right, so longus is going to have the higher attachment, the higher origin point. And here's the second metacarpal, and right here is the third metacarpal where they insert into. Okay, a little tricky muscle there when we're talking about extensor carpi radialis, longus, and brevis. All right, so those are a lot of the muscles that act on the wrist. So now let me just make sure. Give me 1 second. Now we're going to look at muscles that act on the hand and the fingers. So these muscles act on the wrist, the hand, and the fingers. So we have those anterior muscles on the front side. Those are those flexors. Here's the flexors right here. All right. Again, if I was in anatomic position, the front or the anterior side, it would be right there. And those muscles are Pronator Teres, Flexor Carpi Radialis, Palmaris longus, Flexor Carpi Ulnaris, and one that we haven't seen yet, Flexor digitorum superficialis. A deeper layer of muscles on the anterior side, we see two muscles that we haven't talked about yet. Flexor digitorum profundus and Flexor pollicis longus. So let me break down these words for you. Digitorum means the digits. Means the digits. So here's a flexor muscle that's going to the digits. It's going to allow some kind of flexion. We just don't know how yet. The word pollicis means thumb. Pollicis means thumb. So digitorum means the fingers. Pollicis means the thumb. So this is a flexor of the thumb, Flexor pollicis longus. Remember, flexion of the thumb crosses the palm like that. Extension brings it back like that. So let's go over these muscles. Now, the next two muscles are muscles that the national exam loves. They love Flexor digitorum superficialis and Flexor digitorum profundus. And the reason they love them is because one of those muscles only goes to the end of the fingertips to do this motion. Only one of them. And it is imperative that you know which muscle goes to the end of the finger to allow for DIP. Remember the joints. All right. We have the DIP, the distal interphalangeal joint. We have the PI. We have the PIP, the proximal interphalangeal joint, and we have the MCP, the metacarpal phalangeal joint. MCP, yes, the knuckles. Okay. Kind of forgot there. Sorry about that. Had a couple of brain freezes today. My apologies. Been a long week already. Like I said yesterday, I didn't feel too well. Showing its ugly head. All right, so let's look at these muscles. Flexor digitorum profundus. This is going to be a flexor that goes to the fingers. We don't know which fingers yet. Since it's a flexor and it goes to the fingers, it's also going to flex the wrist. Also going to flex the wrist. Since it is a flexor, it should be close to the medial epicondyle. Well, flexor digitorum is the muscle that flexes all the joints of the fingers. So it does this motion. It does this motion. And it does this motion. You take a look at the highlighted bottom. This muscle, flexor digitorum profundus, flexes all the joints of the fingers. All the joints of the fingers. So since it is going to be longer, it's actually going to start a little bit lower. It's going to start a little bit lower. So it actually starts on the proximal ulna. It starts on the ulnar. As you can see in this picture, so it's a flexor. All right, here's the medial epicondyle right here. Well, here's the origin right here on the proximal ulna. It then goes down, it crosses the wrist, which means it's going to flex the wrist, but then it goes to digits 2, digit 3, digit 4, and digit 5. And it goes all the way to the DIP. All the way to the DIP. Flexor digitorum profundus goes all the way to the DIP. Flexor digitorum superficialis only goes to the PIP, which is the joint below it. Talk about it in a second. It is flexor digitorum profundus that flexes the DIP. Superficialis cannot, because it doesn't go up high enough. Like I said, the national exam truly, truly loves these two muscles. They will use it in at least one question. And when we start talking about the national exam a little bit in the first week, not every question is worth the same amount. You don't know how much each question is worth. But there are harder questions and there are easier questions. Any question that you are trying to work with the profundus and superficialis is going to be one of those hard questions. And you get those questions right, you will be joining the club that I'm in as a PTA. No question about it. This is one of those concepts that you need to get a good hold of. So again, flexor digitorum profundus flexes all the joints of the fingers, 2 through 5. It flexes the MCP, the PIP, and the DIP. Flexes all the joints of the fingers. It has an origin on the ulna. The flexor digitorum profundus has 2 nerve innervations, the median and the ulnar nerve. The median and the ulnar nerve innervate this muscle. Remember, because this muscle crosses the wrist, it also does wrist flexion. Okay? But because it crosses the wrist and it crosses all these joints in the fingers and the hand, those are the only things it does. There's no deviation here. No deviation with profundus. The second muscle you must know in the forearm is the flexor digitorum superficialis. The flexor digitorum superficialis. Flexor digitorum superficialis comes from this area here. Here's the origin of it. This muscle, the origin is the medial epicondyle of the humerus. It has a lot of other origin parts to it. I don't want you to worry about that. Flexor digitorum profundus comes from the ulna. Flexor digitorum superficialis comes from the medial epicondyle, comes from the common flexor tendon. All right? Don't get it confused. Know that superficialis has a bunch of other origin points, but they're not as important as the medial epicondyle is. Flexor digitorum superficialis inserts into the middle phalange of digits 2 through 5, the middle phalange, the PIP joint. It does not. It does not go to the DIP. Superficialis does not go to the distal interphalangeal joint. So superficialis cannot do this, cannot flex the DIP joint. It can flex with profundus, the PIP joint, and it can flex the MCP joint with profundus, but it cannot, I repeat it, it cannot flex the DIP joint because superficialis does not go up that high. Does not go up that high. The innervation of superficialis is the median nerve. The actions of the flexor digitorum superficialis is wrist flexion, MCP flexion, and PIP flexion. Again, this muscle does not flex the DIPs of digits 2, 3, 4, and 5. That is a must. Superficialis does not. Flexor digitorum profundus does. Okay? You have got to know these two muscles. All right? It's going to help you get a really important question on that exam because they put something with these two every single exam, all 4 times a year. They love these two muscles. And again, this is a high count question. And you get those high count questions, you guys are going to be PTAs. All right. We spoke about the word pollicis. Pollicis means thumb. This is the flexor pollicis longus. This is a little bit against a lot of what we talk about. If it's a flexor of the wrist, it usually comes from the medial epicondyle. This one does not. It comes from the proximal radius. It actually starts, flexor pollicis longus actually starts in this area right here. Right there. It only goes to the thumb. So the muscle belly right here, it crosses the wrist, which means it's going to perform wrist flexion. And it goes all the way to the end of the thumb. All right. It flexes the CMC and the MCP joints. All right. It is functionally identical to the flexor digitorum profundus. Remember, profundus goes all the way to the DIP of 2 through 5. Flexor pollicis longus allows you to do this with your thumb. Flex the tip, just like that. All right. So again, flexor pollicis longus is going to do wrist flexion and thumb flexion. Okay, thumb flexion going across. It inserts at the base of the distal thumb, innervated by the median nerve. It does wrist flexion and flexes the thumb at the interphalangeal, MCP, and CMC joints. Now, we have a lot of muscles on that anterior side of the hand, all right? We have what we call intrinsics and extrinsics, basically deep muscles and superficial muscles. The extrinsic muscles are usually found in the forearm, and the intrinsics are found in the hand, because in the hand, you can't have big muscles. Most of these muscles are small. Those extrinsic muscles of the forearm allow for flexion and extension of the wrist and the fingers, radial and ulnar deviation, finger abduction and adduction, and thumb opposition. So these muscles in the forearm have a lot of actions, a lot of important actions. The posterior muscles are the extensors. So remember, the anterior muscles are more the flexors. The posterior muscles are more of the extensors of the wrist and fingers. Okay, so on the back of the hand are the extensors. So we have a bunch of muscles on that posterior side. All right, we have on the superficial layer, we have extensor carpi, radialis, longus, and brevis. Those we spoke about. Remember, they go the extensors. This is the extensors that go to metacarpals, the base of the metacarpals 2 and 3 on the extensor side. We have one known as extensor digitorum. This is one that goes to the fingers, digits 2 through 5 on the extensor side. We have extensor digiti minimi. Extensor digiti minimi extends the pinky, just the pinky. And of course, we have extensor carpi ulnaris on the ulnar side. We have deep forearm muscles too. We have abductor pollicis longus. So abduction of the thumb. Remember, pollicis. Extensor pollicis brevis, returning the thumb back to this position. Extensor pollicis longus. And extensor indices. Think of index finger. Extending the index finger, digit number 2, extensor indices. So let's go through these muscles. I'm going to try to get through the upper extremity today so that we can hopefully start the lower extremity on Monday. If not, we're not too far away, thankfully, so it won't be too bad. I'm trying not to rush through them. I'm just trying to take my time and kind of give you as much information. Again, if you haven't had bone and muscle anatomy in a long time, guys, I would start now. Start now. There's it was just the end of week 2 here, so we got 2 more weeks of class plus 3 weeks of vacation. On Monday, you're going to be 5 weeks away from starting. The expectation is that you're coming in knowing the bones and the muscles. And that's one of the reasons we are doing these videos, is to give you a head start, to give you that fighting chance, right? Because you've got to know them. Because when I get into kinesiology, I'm kind of done teaching those muscles. Now in kinesiology, I'm teaching you how the muscles move, all the concepts of movement that you're going to need to know. And it's imperative that you know the muscles that do them. So extensor digitorum. This is a muscle that extends the fingers. Okay. It also extends the wrist. As you can see, big, thick muscle here. Its origin, lateral epicondyle. Big, thick muscle, extensor digitorum. It crosses the wrist, so it's going to be a wrist extensor. It goes all the way to the end of the fingertips on the extensor side. Extensor digitorum of digits 2 through 5. Goes all the way to the end of the fingers. So we do wrist extension. Can't get a lot of wrist extension from a neutral position, but after you flex, the ability to bring it back. This is a radial nerve innervation. It does wrist extension and finger extension. Again, thankfully, it's telling you. As you can see, there's no carpi here. If there was a carpi, it would stop at the carpals or at the metacarpal. It's telling you it extends the fingers. And again, since it passes the wrist here, it's going to extend the wrist. It has to. Okay, so that's the job of extensor digitorum. Nice, big, thick muscle there in the forearm. Extensor indices. Like I said, this muscle extends the index finger. This is a very small muscle. Very small muscle. It actually starts, this muscle is not even close to the lateral epicondyle, the common extensor tendon. This muscle is on the distal ulna, so it's down towards the wrist. It's closer to the wrist than it is to the elbow. So you're looking at a muscle that is right around here. So if I was to move my index finger like this and give it some resistance, I can follow it up like this. Let me see if I can feel it. There it is right here. So it's really small. When I when I extend my index finger, I could feel the muscle move. So the origin of extensor indices is the distal ulna. It inserts into the end of digit number 2. All right. It allows for extension of the index finger. But take a look right here, guys. It crosses the wrist, which means it's going to do wrist extension also. It's going to do wrist extension also. It might not be that strong of a wrist extensor. Might not be as strong as extensor digitorum. I mean, that's a big, thick muscle, and it's coming from a long way. It has physics behind it. It has a long lever arm. Oh, yeah. We talk about that in kinesiology, too. Physics. Oh, you'll love it. All right. Longer lever arm here allows for more strength. Extensor indices is a small muscle, not a lot of strength. So it's not a strong wrist extensor, but it's going to help extend the wrist. But it also helps extend the index finger. Extensor indices. Extensor digiti minimi. This is where we extend the pinky finger. Extensor digiti minimi comes from the lateral epicondyle. It goes to the DIP of the 5th digit. This is a radial nerve innervation. Since it crosses the wrist, it does wrist extension. And it extends the pinky finger, digit number 5. Digiti minimi, small digit. Pinky is the small digit. Indices is the index finger. Some special muscles. All right, so let's talk a little bit about carpal tunnel syndrome. This is a disease process that a lot of people have. A lot of secretaries have it. Anybody that really truly uses their hand and wrist on an everyday basis continuously will most likely have carpal tunnel syndrome. What it is that the carpal tunnel is a very, very tight space. All right. between something known as the flexor retinaculum. It's a piece of tissue that goes over this area of the wrist. They call it a bracelet-like fibrous sheet that the flexor tendons that flex the wrist and pass their way to their insertions. So there is this retinaculum on the top, the carpals on the bottom, and then there's a tunnel between it. That tunnel is known as the carpal tunnel. The carpal tunnel is a tight space between the flexor retinaculum tissue and the carpal bones. It is flexor tendons that go through the carpal tunnel. Also a nerve. But when we're talking about muscles, it is the flexor tendons, not the extensors, that go through the carpal tunnel. This side right here. So the tunnel is created by a sheath on the top and the carpal bones on the bottom. Flexor muscles pass through that tunnel, and the median nerve passes through that tunnel. Carpal tunnel syndrome is a median nerve disease process. Carpal tunnel syndrome is a median nerve disease process. People get carpal tunnel syndrome from repetitive wrist motions, repetitive finger motions that cause this area to become inflamed, swollen, and a word known as fibrotic, where the fibrous tissues actually harden and cause a decrease in movement. When we're talking about inflammation, we're not talking about swelling. We're actually talking about a few characteristics. All right. And swelling is one of the characteristics of inflammation. When you hear the word inflammation, you should be thinking red, hot, swollen, and painful. And because of those four characteristics, we have a fifth characteristic, which is a lack or a decrease in range of motion. So whenever you hear inflammation, swelling is a characteristic of inflammation, but it's not everything. The area is red. The area is hot. The area is painful. There is swelling there, and that leads to a decrease in range of motion. So that's what causes and puts pressure on those muscles, those flexor muscles, and especially the median nerve. When you put pressure on a nerve, you can get tingling and pain into the fingers, muscle weakness also. So carpal tunnel syndrome puts pressure on the median nerve that passes through the tunnel along with the finger tendons. There is tingling and muscle weakness in the palm and the medial side of the hand. This pain can radiate into the arm and the shoulder. The treatment that we perform, well, doctors will give them anti-inflammatory drugs. We can't as PTAs. We can order them a wrist immobilizer to help keep their wrist in a constant position so that it's not prolonged in a position that's going to put pressure on the carpal tunnel. We use ice and we use electric stimulation. We try to calm things down. But if we can't, and we're considered a conservative treatment, all right? If we can't get them better, then sometimes the doctors will go in and perform a surgery, and they'll actually remove that tissue, that flexor retinaculum, because it's the flexor retinaculum that's putting pressure on that tunnel. By cutting part of it out, we're taking the pressure away, hence most likely relieving the pressure on the median nerve and on those flexor muscles. So I'm going to want you to know what carpal tunnel syndrome is, what are the structures located in the tunnel. I have a picture coming up that'll show you, but it's the flexor muscles, it's the median nerve, and there are some blood vessels and arteries and things like that. But what I need you to know is that it is the flexors of the wrist and hand and the median nerve that go through the carpal tunnel. So in this picture, this white area that's covering up, that's over all of these tissues here, is the flexor retinaculum. This is the cover of the carpal tunnel. Underneath, right here in this area, are the carpals themselves. So now there's a tunnel that goes in between. This yellow structure is the median nerve. As you can see, if that retinaculum puts pressure on that median nerve, it's going to cause some problems. But then take a look around. So here's the flexor digitorum profundus. And here is flexor digitorum superficialis. And flexor pollicis longus isn't, oh yeah, it is. It is in the tendon. But you got this muscle right here, flexor carpi ulnaris, which is not in there, which is not in the carpal tunnel. So you see all these structures go between the flexor retinaculum and the carpal bones. And if there's pressure, it can cause tingling, pain, numbness, weakness, and that pain and numbness can actually go up as high as the shoulder area. This. You'll be very thankful to know that a lot of these muscles you're not going to need to know. So I'm going to kind of go through them, and I'm going to tell you which muscles you will need to know. These are the intrinsics of the hand, the small muscles of the hand. Now, a lot of these muscles you're going to get an idea because it's going to tell you which, like it's going to tell you pollicis something. It's going to tell you, it's going to talk about opposition. It's going to talk about abduction and things like that. So I will guide you and tell you what you're going to need to know. This is the opponens digiti minimi. So when we're doing opposition with the thumb, this is opposition of the pinky right here. This muscle performs opposition of the pinky. As you'll notice, there's no star next to it. You're not going to need to know it. But understand, just by the name, it's going to tell you what it does. Opponens pollicis. That's where the thumb comes across and does opposition. So in order for the pinky and the thumb to perform opposition, you need opponens digiti minimi and opponens pollicis to do that. Abductor pollicis brevis. So this is an abduction of the pollicis, of the thumb. So this is flexion, extension. Abduction is coming towards you of the thumb, and adduction is coming back to neutral. So abductor pollicis brevis, flexor pollicis brevis is the muscle that performs this, the thumb coming across, flexing the thumb. Abductor digiti minimi. So when we abduct our fingers, the abductor digiti minimi is the one that abducts the pinky finger, abducts the fifth digit. Flexor digiti minimi brevis, small muscle. Again, digiti minimi is the pinky, and it's a flexor. So it flexes the MCP, flexes the MCP. Now, this you're going to need to know. You're going to need to know about the interossei, because the interossei are specific small muscles that do a specific job. I need you to know the job of the palmar interossei and the dorsal interossei. Now, these are small muscles that go between the metacarpals. They're small muscles that basically go between the metacarpals. The palmar interossei, the one on the left, adducts the finger. Well, let me start the one on the right. Dorsal interossei abducts the fingers, brings the fingers apart. The palmar interossei adducts. So dorsal abduction, palmar adduction. One that I made up recently, I made up an acronym recently for you folks that watch football, and Cam Newton. Cam Newton, when he was really playing well before he got to New England, was he did things known as dabbing. He dabbed, more like that. He scored a touchdown. He's like, that's known as dabbing. So dorsal abduction is dab. Palmar adduction is pad. Dab pad. I know it doesn't, it's not as good as BBB and ABC plus pec major, but it's one that I made up, and I actually remember it pretty easily with that. The dab pad. Dorsal does abduction of the fingers. Palmar does adduction of the fingers. Need to know what the dorsal and palmar interossei do. All right. We're up to the lower extremity. Hoo-wah. All right. What we'll do is we will stop here today. I will send this video out either tonight or tomorrow morning, probably more tomorrow morning, since I am off tomorrow. I will send it out in the morning to you guys. Please, if you have any questions, if you want me to open it up and I will accept them. I will be on and off tonight, probably till about 9 o'clock. Every hour or so, I'll check my email, and hopefully you guys will send me acceptances, and I will accept it, and you can watch the videos. On Monday, we will start the lower extremity. Let me, so we're at slide number 92 out of 145. So we got about another 50 slides left. So we're going to work on the lower extremity. So we'll probably finish up the muscles probably on Tuesday of next week. And we will kind of jump back to the bones and kind of combine the bones and the muscles together to remind you what the origins and insertions are. All right. And to kind of go over those landmarks again on those bones. Again, if you have any questions at all, please feel free to write me. All right. I'm at edunn at kaiseruniversity.edu. I will get back to you ASAP, I promise. And other than that, I guess we're going to end it for today. All right, guys, have a wonderful weekend. I will see you Monday at 2 o'clock. We'll go 2 to 4 on Monday of week 3. Again, have a wonderful weekend. Stay safe and stay very, very healthy, please. We want to see you guys in 5 weeks. All right. Ciao.